In a health alert this morning, doctors are trying to spread awareness about a disease caused by blocked arteries in your legs. Sean Chittin is staying by live in Yakima this morning with more about peripheral artery disease, or PAD. Good morning, Sean.
Melanie, good morning. We are back here at Pacific Vascular doing the next step in the testing process, joined again by Dr. Justin Robinson, who is with Yakima Vascular Associates. And Doctor, last half hour we took a test for our patient Shay here to figure out if he had PAD. And we're going to pretend that now he does, and we're going to do the next step. What's that?
Right. The next step after we've decided that the patient has vascular disease is to find out in general where it's located in the leg and how severe it is. And for that we do a duplex scan of the leg. And that's an ultrasound test where we can actually see the arteries using sound waves and then measure the speed of the blood as it goes through the artery.
So we'll step away, and once again Sarah's going to come in and start the test. Talk to us a little bit about what she's doing.
Sarah's using a ultrasound machine and a transducer to look at the and projecting sound waves into the leg and finding the artery. And then when she does that, we can see plaque in the artery, and then we can use the sound waves to measure how fast the blood is going through the artery. And as the plaques build up inside the artery and they narrow down the artery, the blood has to squirt through faster in order to get through down to the foot. So as it goes faster, we can measure that, and we know that at certain speeds there's a certain amount of narrowing in the artery. So if it gets very narrowed, the blood is squirting through extremely fast.
And then with that information, where do you take that to make the next step in working with a patient?
Well, once we know how severe each lesion is at each level of the leg and up in the pelvis, and where they're located, then we can decide how we might want to address that. And that may be using just medication if it's very mild, or going to the cath lab to put in stents like we were talking about before, or even doing bypass surgery where we put a bypass graft above and below the narrowed or obstructed area.
And so then quickly, the bottom line when we're talking about PAD awareness, what do people need to remember?
If you think you may have PAD, then you need to talk to your primary care physician about that to see whether or not you might need to get screened or get further extensive testing like this. And the nice thing about this kind of testing is that it's all with sound waves. There's no radiation, there's no needles, there's no pain. And it gives us a lot of information on how to treat you and what your prospects are.
Well, our thanks to Dr. Robinson, Shay, and Sarah for helping us out this morning and letting us learn a little bit more about PAD. Live in Yakima, Sean Chittin, KNDO, right now.